Welcome to Kidney Intel. Hi, I'm Terrie, and I'm a renal dietitian. And if you have kidney disease, managing your phosphorus in your diet can be tricky. There's a lot of conflicting information out there, especially if you've Googled a low phosphorus diet, or if you received information on following a low phosphorus diet from your healthcare provider. In this video, I'm going to review with you 3 things that I recommend to my patients in helping them to manage the phosphorus in their diet. So let's get started. In the video part 1 about phosphorus and kidney disease, we learned that there were 2 forms of phosphorus, organic phosphorus and inorganic phosphorus. And we learned that the main difference between those 2 forms of phosphorus is how much of that phosphorus is absorbed in our body. Organic phosphorus is found in our fresh meats, fish, poultry, and dairy. And it is believed that we absorb about 60 to 80% of the phosphorus found in those foods. Another form of organic phosphorus is plant-based foods. This would be whole wheats, nuts and seeds, beans and lentils. And it is believed that we absorb 20 to 40% of the phosphorus coming from these foods. Inorganic phosphorus are phosphorus additives. These are phosphorus additives that have been added to our foods by manufacturers to help preserve and to keep our foods fresh. So here are a few examples of how much phosphorus is found in our organic and inorganic phosphorus foods, and how little or how much phosphorus is absorbed in our bloodstream. So when we look at chickpeas, a half a cup of chickpeas contains about 30 milligrams of phosphorus, and we absorb about 28 to 36 milligrams. In a 3-ounce chicken breast, it contains about 200 milligrams of phosphorus, and we absorb about 120 to 160 milligrams of phosphorus. And for inorganic phosphorus, an example would be a Hawaiian punch in a 12-ounce glass. It contains 150 milligrams of phosphorus, and we absorb almost 150 milligrams of phosphorus. So you might be wondering, why is phosphorus being added to our foods? Phosphorus is added to our foods by manufacturers to help extend a product's shelf life. It helps to make a food creamier or easier to melt. And it helps powdered products from getting clumpy. Phosphorus additives are common in foods such as fast foods, deli meats, spreadable cheeses, canned or bottled beverages. Honestly, anything that comes in a box or a package, a bottle or a jar, can very likely contain phosphorus additives. These additives are identified by FDA as generally recognized as safe, meaning they are deemed safe for under the conditions of its intended use. So let's review my 3 recommendations to help you manage the phosphorus in your diet. Recommendation number 1 is read the ingredient list on a package. Check your food labels for common phosphorus additives, looking for the word phosphorus, phosphate, phosphoric, or those 4 letters of PHOS. And an important note is ingredient lists can change over time. A product that doesn't contain a phosphorus additive before may have phosphorus additives added later on. So that's why it's important to always check the ingredient list each time you buy a product, even if it's something that you have purchased before. Recommendation number 2 is swap out products that have phosphorus additives for products that don't. And it does require a little bit of detective work. So you'll see in this example of the Coffee Mate creamer, it does contain phosphorus additives. And in the next example of the Silk almond creamer, it does not contain any phosphorus additives. For the protein bars of MedX, it does contain at least 2 phosphorus additives compared to the Cliff Bar that does not contain phosphorus additives. And finally, in our ranch dressing, the Hidden Valley ranch dressing does contain at least 2 phosphorus additives, and the Boathouse Farms ranch dressing does not contain any phosphorus additives. And here's a fun fact about phosphorus additives. Cola drinks don't naturally have a brown color. Without a phosphorus additives, they would turn very dark, almost black in color. Phosphorus is added to stop a chemical reaction that would make this drink darker in color. Because of this, cola gets its familiar dark appearance. Recommendations number 3 is moving towards more of a plant-based diet. Our bodies don't absorb near amount of phosphorus in plant-based foods as it does coming from animal or packaged or processed foods. And plant-based foods provide a wide number of health benefits for our bodies. Plant-based foods help with containing an abundant amount of vitamins and minerals, antioxidants. They're high in dietary fiber. They have limited amount of calories and can help with maintaining our blood sugar control, just to name a few benefits. So to recap, to help you to manage the phosphorus in your diet at any stage of kidney disease, number 1, remember to read the ingredient list and looking for products that contain phosphorus additives. And number 2 recommendation is swapping out those products that do have phosphorus additives for products that do not contain phosphorus additives. And number 3 recommendation is to move towards more of a plant-based diet. Remember, it's not about being perfect. Every small, gradual change that you can make in your diet can make a big difference in protecting your kidney health over time. And if you're ready to take the next step in protecting your kidney health, I invite you to visit my website called Kidney Intel and explore my online class called Kidney Essentials for practical, easy to follow strategies on nutrition and everyday choices to help support your kidneys. You'll find the link to my website below. I'm Terrie Holewinski, a kidney dietitian with Kidney Intel. I hope that you found this video to be helpful. Please like me and share this video with someone who you feel can benefit from it too. Until next time.